Okay, so for the next skill that we're going to do is tracheostomy care. Again, this is not best practice. This is just to show you guys how ANSONS Arm works at home. So the first thing that you're going to do, of course, is just to check your doctor's orders to make sure that we can actually do this procedure. And if it's just PRN, we can just do it as needed. The next thing I like to do, of course, is just to put them in high Fowlers or semi-Fowlers, just to make sure that they're getting the best oxygen that they can. Next, I like to put up the blue pad just in case any kind of secretions come up, then they're well protected. On top of that too, I like to keep the oxygen near them as well, just because if I need it in an emergency case, I can just put it up right there, making sure your oxygen is actually on the wall. Then from there, what we're going to do is we're going to actually just remove the inner cannula, and we're going to place it in either sterile water or hydrogen peroxide, depending on what your doctor's orders are. And then from there, we can just assess the stoma and see how it's doing, making sure that there's no signs of infection or anything like that around the stoma. And we're just going to remove the old dressing, and of course, just seeing if there's any signs of infection or anything like that around the stoma. From there, we're just going to grab some cotton tip applicators, and we're just going to clean around the stoma, just like so, and just ensuring that there's no drainage or anything like that, and no signs of infection. From there, if we want to put on a new dressing, all you have to do is just take your gauze, kind of just flip it down, and put it all the way back up. And then for our inner cannula, of course, if you had a tracheostomy kit, then you can clean this and scrub it all up and stuff like that. And then once you're done, then you can just insert it back into the tracheostomy there. And then of course, seeing the oxygen saturation after the procedure, and of course, just making sure that the client is safe before you're leaving, and just remember to document.